focusing on care of fractures about the hip, proximal femur, top of your thigh, that are due to ground level falls, really in an age population over 65. And by definition, that's going to be a patient that has some degree of osteoporosis. Those are not high energy falls, they're low energy falls, but enough in a weakened bone to cause a fracture. Osteoporosis, it's not necessarily that the bone itself is bad. I actually had this conversation with a patient yesterday, and I said, your bone's not bad, you just don't have enough of it. And so that's really a good general definition of osteoporosis, and with less bone, the chances of having an injury increase. We will do x-rays of the affected region, area of pain for starters, but then we may look further down around the lower limb and other areas. But the x-ray will usually help us in identifying a fracture of the hip, certainly if it's displaced or the pieces are not together. Sometimes they have a fracture that's not easily seen on x-ray, and we'll do other studies like a CAT scan to further detail that area. The literature has shown over the last 5 to 7 years in centers that can rapidly get these patients to surgery. Those are the patients that do well. The goals are to really get that patient back to a pre-fracture level of activity. And it's been shown that the best indicator of that is getting them to surgery quickly. Once we fix their bones, the implants now are good enough that we can immediately weight bear them, so that really helps them move. Typically, the recovery after a surgical fixation of a fragility fracture of the hip is a hospital stay of around 3 to 4 days. The long-term answer is that it's really going to take probably 6 months on average to get over this hip fracture, and really a full year till you feel like you're back doing all the things that you want to do. Patients that have had a fall and had a fracture probably have an osteoporotic fragility fracture. There are medical tests that can be done to identify the severity of that, such as vitamin D levels, but also there are radiographic and radiologic tests that can be done, and particularly we utilize the bone density examinations, which should be done at least every 2 years, and that should be coordinated through your primary care doctor. Certainly patients that come through the Fragility Fracture Center are enrolled in a program to ensure that that has been done, or they are on the proper timetable to have that updated. And certainly working on patients to build up their stamina, strength, and endurance, because that certainly helps with balance. And the more coordinated you are, the stronger you are, the less chance you have of having another fall. A lot of them are simple over-the-counter remedies. Really, after age 40, certainly all women, but probably men should start looking at 1,200 to 1,500 milligrams of just over-the-counter supplemental calcium. Once you're diagnosed with osteoporosis, your primary care doctor or endocrinologist can help you identify if there are other heavy-duty medications you can take.